Hello and welcome. Let's talk about acute osteomyelitis. So, what does it mean by acute osteomyelitis? It is defined as an inflammation of bone and its bone marrow. Or, osteomyelitis is defined as an inflammatory condition of bone that usually begins as an infection of the medullary cavity and rapidly involves the Haberson system and quickly extends to the periosteum of the area. In this picture, you can see the osteomyelitis. Now, this is an X-ray showing osteomyelitis. Now, predisposing factors for acute osteomyelitis. Broad bone foci, age, infancy and childhood are common. Sex, male to female ratio is 4:1. Trauma in 50% of the case. Poor nutrition and unhygienic surroundings. Organisms causing acute osteomyelitis. Staphylococcus aureus, which is the most common organism. Streptococcus, pneumococcus, Staphylococcus albus, hemophilia, salmonella, bacteroids, pseudomonas, proteus, E. coli, klebsiella and brucella, which is rare. Now, pathogenesis of acute pyogenic osteomyelitis. The infection at metaphyseal endosteum, which percolate through Haberson system to periosteum and shape periosteal abscess formation, which leaves the periosteum, and there is ischemia and suppurative necrosis of bone, which lead to segmental bone necrosis and formation of piece of dead bone, which is known as sequestrium, and then formation of soft tissue abscess and rupture of abscess through periosteum. Now, the source of infection in acute heterogeneous osteomyelitis is upper respiratory tract infection like tonsillitis, adenitis, boils and abscess, bacteremia, septicemia or pyemia. So, why is acute osteomyelitis common in children? Because of the inadequate immunity, so trauma in malnourished children causes colonization of bacteria, and all the bones are rapidly growing and more vascular, and the thin and more elastic periosteum of children. Now, the bones commonly affected are femur, tibia and humerus. So, why joint is not involved? The growth plate in the children does not allow penetration of blood vessel in joint cavity. The bone commonly involved in osteomyelitis is metaphysis because of the hairpin manner of the blood vessel in metaphysis of long bone in children. Now, clinical features. Age, confined to children about 5 to 13 years old age. Sex, more in boys because they are more susceptible to trauma. Sites, more commonly affects the tibia, femur and humerus. Onset is rapid and there may be history of the recent boils or of minor injury or repeated infection. Often the soft tissues are indurated and later a flatulent abscess may be present. There may be severe pain over the affected bone, fever, local rise of temperature and tenderness, pulse leading to tachycardia, tenderness in the near joint and restricted joint movement. Now, investigation. On X-ray, there is soft tissue swelling and deposition of the new bone by the elevated periosteum and periosteal thickening and patchy bone destruction. Now, radioisotope bone scanning with tectonium, ESR is raised, WBC count is elevated, blood culture, USG, MRL, C-reactive protein and aspiration of fluid for Granny Stenen culture. Now, principles of treatment. Broad spectrum antibiotic according to the sensitivity, local support and wait for 24 hours and see. If improving, treatment should be continued. If static, explanation of the part, and if no improvement, explanation of the part and post drainage should be done. Analgesic should be given. Now, treatment. Absolute bed rest, the limb is splinted, antibiotic according to sensitivity, blood culture is helpful, cloxacillin 500 mg 6 hourly or oral for 28 days. And ampicillin and cloxacillin may be given simultaneously. Now, surgical treatment includes an incision is made over the tender area and carried down to the bone. The abscess cavity is fully opened and the pus is evacuated. A swab is taken for culture and sensitivity at this stage, and the wound is then closed with interrupted sutures over a closed sterile suction drain. Antibiotics and local splintage are continued postoperatively. Now, differential diagnosis. Acute suppurative arthritis, acute rheumatoid arthritis, hemarthrosis, scurvy and Ewing's tumor. Now, complications of acute osteomyelitis. Local includes chronic osteomyelitis, pyogenic arthritis, pathological fracture, deformity and retardation of growth arrest. General includes septicemia and pyemia. End of the topic.